in bats which rabies are prevalent. That's a vector. The portal of entry is the same, can be the same as the exit. Okay? You have an entry. And this can also, so the pathogen can enter by way of ingestion, so through the mouth, through breathing, through an injection across a mucous membrane, a break in the skin. Susceptible hosts are frequently individuals whose health has been impaired. In addition, the primary problem that caused their hospitalization, secondary infections may develop. We talked about that earlier. Hospital-acquired infections pose a threat to healthcare workers as well as the patients. I mean, it goes both ways. So, these nosocomial infections are extremely dangerous, possibly resulting in bed sores, illnesses, and also even death. There has been a resurgence of tuberculosis. I'm going to skip down here. There has been a resurgence in tuberculosis. Thought that had been wiped out. And this has to do with immigrants coming from countries that are considered, and again, I'm using this very loosely, coming from poor communities or dirty environment. Okay, so they lived in an environment of squalor. Okay, they, third world country, so they come here. And so this is how there has been an increase in tuberculosis. And the thing about tuberculosis is it's not very apparent. You can, right now there can be 2 or 3 of you guys in here that have TB and not know it. Okay? Many of us are here in this room are carriers of some kind of illness or disease and we don't know it. TB being one of them. So TB is considered a respiratory type of infection, but it's also can be located in other parts of your body, including your GI tract. So there's been a resurgence of that. And when I talk to my doctor friends, they say you can get TB as easily as going to the grocery store and not even know it. Okay? Picking up a piece of fruit. Okay? The fruit, vegetables are all out in the open. People are constantly picking it up, squeezing it, smelling it, okay? And what do you, so that's why they tell us, so when they're telling you to wash your fruits and vegetables, it's not simply to get rid of the pesticides. You got to think about the human side of it and the bacterial and the virus and all that other stuff that comes along with it, whoever handles the fruits and the vegetables. There's been an increased number of ER patients. So again, we're talking about nosocomial infections. When the emergency room becomes saturated, in other words, when they are seeing a lot of patients, sometimes the doctors and the nurses don't follow proper protocol because they're trying to get the patients in as quickly as possible. So they don't do proper screening. There have been many times where I've done a portable chest x-ray. 30 minutes later, I find out that the patient has TB. 8 hours later, I find out that the patient that I did a portable in ICU has chickenpox. Okay? They're seeing the patient so quickly, they're not going through the proper protocol. And so that's another reason why there is a rise in nosocomial infections, not just for patients, but also personnel. So how are you going to protect yourself from those type of situations? What's minimum requirements? At least wear a glove. That's how you're going to protect yourself. But again, do you see your technologists doing that? When they come in contact with a patient? Hardly ever, or never. Okay? And it's just going to take that one time that you are trying to move a patient and all of a sudden you feel something wet and gooey. It's just going to take that one time. Okay, urinary tract and the bloodstream we said was the #1 media for transmission of these diseases. So medical asepsis is the first line of defense in preventing the spread of disease. Washing your hands in between patients, following universal precautions. Again, universal and standard is the same thing. By wearing gloves and other protective wear and washing your hands after removing your gloves help prevent the transmission of infectious microorganisms. So there is, we tell you to wash your hands, but there's also such a thing as washing your hands too much. And if you do, make sure that you keep them nice and moisturized, okay? So the CDC hand washing guidelines for healthcare workers, this is how you're supposed to wash it. I'm not going to go through this. I think we're all we're all big enough to know what we're supposed to do, okay? Wash your hands using friction, using soap for 20 seconds. You're also going through the webs of your fingers. You've got to be very, very thorough, all right? And when you're done washing your hands, then you're going to touch the faucet and turn it off, right? No.
With the paper towel.
So whiz the paper towel.
A clean one.
A clean one. So you want to make sure that the paper towel is dispensed before you turn on the faucet. So after you wash your hands, now you can rip the paper towel away and use that to turn off the faucet. And then what are you going to do now? No, don't throw it away yet.
Use it to open the door.
You're going to use it to open the door. Yeah, you're going to use it to open the door. Now you can toss it in the receptacle. Okay? All right, so I guess you guys can go through that. All right, the immune system, your immune system. Antigens are foreign or unrecognizable organic substances that invades the body, and then your body has antibodies in response to those antigens, and they help build immunity. They are generally found in tear, saliva, spinal fluid, and also the colostrum or colostrum. What is that? What is colostrum? Colostrum. Milk? Okay, yeah, mother's milk, mama's milk. Okay, chock full of antibodies. Okay, that's how kids build their immunity at the beginning of life, is through mother's milk. And that's why, doctors and clinicians, they encourage the moms to breastfeed when possible. Vaccination is artificial immunity. Again, huge debate. But it basically builds antibodies with vaccination. By the way, this is on the test. I know that for sure. So antibodies are found where, and then you're going to tell me where.
Thank you.
So the immune system is not always a good thing. Sometimes it can attack you. Remember, anytime you have too much of something, it's not usually good. It's bad. So this is one of the things where a good thing can turn against you, your autoimmune disease. So individuals' own antibodies destroy healthy tissue. A couple of examples is rheumatoid arthritis and also multiple sclerosis. All right? Questions? None. All right. The infectious process, not to be confused with the cycle of infection. The infectious process is once you are infected, what happens? So once you are infected, what happens? The first one here is the incubation stage, where the pathogen is dormant without any type of specific symptoms. The next one is the prodromal stage, where some of the symptoms start to demonstrate, and now you are highly infectious, which means that you are now more susceptible to the pathogen's ability to get you even more sick. You are more infectious, not to confuse with this next one here, full disease, full symptoms, highly contagious. These two words are sometimes interchanged, but it's incorrect. Infectious, highly infectious means there's a greater chance of you getting more sick, representing with more symptoms of the infection. Whereas someone who's highly contagious, that means I have the ability to get you sick. Highly contagious. And then the last stage here is convalescent stage, where the symptoms start to disappear. Some disease goes dormant until, again, all it takes is just that the right environment, and it can set it off again. Okay, so incubation, prodromal, full disease, and then convalescent stage. All right, so here we have HIV, or human immunodeficiency virus. HIV is a virus that causes AIDS. Again, these are terms again that are used interchangeably, and they shouldn't, because HIV is the virus that causes AIDS. The virus may be passed from one person to another when infected blood, semen, and vaginal secretions come in contact with an uninfected person's broken skin or mucous membrane. People with HIV have what is called an HIV infection. They have an infection. HIV suppresses the immune system of the body and renders it unable to resist opportunistic infections. So it suppresses the immune system of the body. So this process here of immunodepression or suppression is AIDS. AIDS is caused by the HIV virus. So a person with an HIV infection may not demonstrate symptoms of acquired immunodeficiency syndrome for several years following infection. A person infected with HIV who does not develop AIDS may unknowingly transmit the virus to another. So AIDS demonstrates with a serious infection. So AIDS is basically the individual's ability to fight an infection. Even things like a common cold, they can't fight it because their immunity has been suppressed. So someone who has AIDS is a series of these different types of infections. So AIDS demonstrates with a series of infections which are opportunistic in nature. So it's proper to say that they died from complications from AIDS rather than they died from AIDS. AIDS is the condition, but when they die of pneumonia, for example. They die of some sort of respiratory tract infection. They die of maybe some sort of skin lesions. Okay? So here are some examples. Some commonly seen diseases, infections with AIDS includes pneumocystis, herpes and skin lesions, and also dementia caused from AIDS. The bloodstream is a chronic carrier of HIV. The most common method of spreading HIV virus is by direct contact, where the victim actively and directly contacts the infectious source. Including what? It's not just person to person. What else? How else can you get AIDS?
To object and broken skin.
The needle. Remember the needle?
Sharing.
Yeah. Okay, remember needle falls under that category of direct contact. So all sexual transmitted diseases, such as HIV, AIDS, an exit site must come in contact with an entry site. No other means of transmission has been proved. Again, I beg to differ. AIDS cannot be cured. Treatment is done palliatively. So again, there is no cure for AIDS. So treatment is done to minimize the symptoms, to make the patient more comfortable. Okay, pain-free as much as possible. But it also slows down the progression of the disease. It prevents other infections. And again, hopefully it suppresses the symptoms so the patient is a lot more comfortable. HIV in the imaging professional, only 0.0016% of reported AIDS cases have involved contraction in the healthcare workplace. Nearly every case involved loss of anatomic integrity, meaning that there is some sort of broken skin that's been involved. Table 6 lists infectious and non-infectious bodily fluids. in relation to HIV. So you guys can look through that and get familiar with that. So if you have HIV, breast milk is non-infectious. Sweat, nasal secretions, tears, saliva, sputum, and urine and stool are not considered infectious type of substances. But again, if there's a break in the skin, possibly, because now it's coming in contact with blood. So infectious includes blood, body fluids, pus, semen, vaginal secretions, cerebral spinal fluid, synovial fluid. So this is your joints. So fluid from your joints is infectious. Pleural fluid from your lungs, peritoneal fluid from your abdomen, pericardial fluid from your heart, and amniotic fluid from the urinary sac. Yeah. In treating patients in the manner of assuming that they are all carriers and high risk, they must also be treated in the same non-judgmental and professional manner that you would treat a non-AIDS patient. Maintenance of strict confidentiality is mandatory when caring for a patient with known HIV infection or with AIDS. So you guys understand HIPAA and patient confidentiality. Sometimes a patient may come into the hospital with known HIV and AIDS, and they don't want the family members to know, and you have to respect that, that confidentiality. Now, when it comes to caring for someone who has AIDS, that's kind of where we draw the line. Because if I know that somebody has HIV, AIDS, I will let the next caregiver know that this person has HIV, AIDS for their protection. So there's a difference in that confidentiality. So if it has to do with the safety of another individual, that's where confidentiality is out the door. Okay. Now, as technologists, as caregivers, I'm not concerned about HIV as much as I am about hepatitis, because hepatitis is more prevalent. It is more common in the community. So hepatitis is a chronic inflammation of the liver. The most common one here is Hep C. Hep C is the most common form of blood-borne hepatitis and an important healthcare occupational hazard. Hep C is more infectious than HIV, and then Hep B is the second most common. And then you have your numbers there. In the U.S., approximately 800,000 to 1.4 million are infected with hepatitis B, whereas 2.9 to 3.7 million have chronic Hep C. So B, there is no cure, but it is treatable. C is curable, and then Hep D, didn't talk about here, there is no cure, but it's also treatable. There's also Hep A that I didn't talk about in here, but these are the most common ones. So how do you acquire hepatitis? Well, through needle stick, whether it's accidental or shared, IV drug use, sharing of razors, toothbrush, or other personal hygiene items, tattooing and piercing. And it may start off as hepatitis, but it can lead to other types of life-threatening diseases, including cirrhosis and also liver cancer. Okay, so it may start off as hepatitis, but it can lead to other different types of liver diseases. Yes?
So no cure but treatable. How does it work?
Treatable in that it can minimize the amount of the Hep C virus in the system. It doesn't completely go away, it just minimizes it. And also remember that Hep C acts upon the liver and destroys it. So if we can minimize the amount of Hep C virus in there, we can sustain the liver. Yeah. Less damage to the liver, I should say. So to prevent HIV and hepatitis infection, the imaging professional must follow the universal precautions for blood and bodily fluids. Follow barrier precautions for procedure involving contact with blood, mucous membranes, or non-intact skin of patients. You take extra care when dealing with sharp objects, such as needles and scalpels, to prevent injury. Now, this here, we're going to be dealing with needles. okay? And one of the things that Mr. Benoit are going to observe is your proper handling and disposal of those needles. And one thing that you guys should never ever do is never recap your needles. Now the needles that we use, there are no caps to go with it. But this is what we see, and we try to discourage you guys from doing this, is that once you guys get a stick, you demonstrate you got a stick, successful, and then we say take the needle out, okay? And this is what we don't want happening. You don't take the needle out and place it down on your table, okay? Because now you are leaving some kind of hazardous material that not only you can get stuck on, but anybody in your surroundings can accidentally stick themselves with, okay? So what we tell you to do is once you take that needle out, have the person who got stuck hold the pressure themselves. There's no need for you to hold it. Take the needle out and have them hold it themselves. And you take that needle, and you're going to come around and put it in a red receptacle. And that's how you're going to get rid of it. That's how we eliminate the hazards. It's by directly out and into a receptacle, never ever leaving it out. Okay? But now on the field, it may be a little bit different. What if you do have a needle that comes with a cap? Okay? This is what can happen. So you never ever recap a needle. Okay? What you do is you get rid of it immediately. Needles are only like pennies a piece. So just get rid of it. Don't save it. Don't recycle it. There's no need for that. Okay? So don't recap it. I work with a lot of old school doctors who try to recap their needles. You know what I do? I said, put it down, step away. I said, just put it down, doctor, I'll handle it, I'll dispose of it. But they're doing this. And especially if they're like shaky. All right, but if you have to, okay, they do what's known as the one-handed method, okay? And again, this is something that we've incorporated a lot in special procedures in the cardiac cath lab because we deal with needle caps like this. And we've all been taught to do the one-scoop method because the other hand is not involved. You can't stick yourself if you're not using your other hand. So they just put the cap on a flat counter and they scoop it up with the needle and they just tighten it, okay? But if the question on the test says recapping is acceptable, what are you going to answer?
No.
False.
No. False. B. What if I do?
Change it to A, don't do that.
I've always thought about that.
No.
B, yeah, A is false, B is true.
Oh. Cruel, cruel.
Okay. All right, so never recap. Avoid mouth-to-mouth resuscitation when ventilation devices are also available. Again, we're talking about HIV and bloodborne pathogens. All right, tuberculosis. Tuberculosis is caused by spore-forming bacteria. It is an airborne contaminant, most common in lungs, but also can affect other areas. Increased incidence in the U.S. due to increasing immigrant population, also HIV, and it is highly communicable. Again, it is easily transmittable, highly contagious. Have you guys all been fitted with TB masks?
No.
Yeah. Yes? No?
No.
No? Okay. What hospitals are you in?
Anaheim Regional.
Downey
Anaheim
PRH.
Regional? Okay. Eventually you guys will be. The other hospitals, it's mandatory that you guys get fitted before you even start. But those hospitals, eventually you guys will get fitted. Now, if you've ever worn one of those N95s, it's hard to breathe. Okay? And the fibers are so they're interwoven so tightly. The whole purpose is to prevent any droplets from going into your respiratory tract. So they have to be tightly woven. So when you wear one of those, it feels like someone's doing this to your face. And you're like, can't breathe. Okay? They do what's known as like, when I got tested for it, I put on a different size mask. Then they'll put a cover on my head and they'll spray sucrose in there. And if you can taste it, that means that you're not fitted well.
It's bitter.
Yeah, it's bitter. Well, it was sweet for me.
Oh.
Yeah. And then I try on different masks. They'll spray it again in the hoodie. And at a point where I can't taste it, then it's a correct fit. Yeah.
I never passed that, so they gave me, they tested, they said like popper or whatever, that helmet I'm gonna wear. I'm still not in the clinical, so.
Okay, so with TB, usually no apparent signs. So again, it's you. Most people who have TB, they're carriers without who are asymptomatic. However, if it starts to demonstrate, early stages includes fatigue, loss of appetite, weight loss, fever, and also night sweats. Later stages includes coughing, hemoptysis. What's hemoptysis? Okay. Wheezing, rales, tracheal deviation, also chest pain. Wheezing is kind of like rales is a crackly type of breath. And then tracheal deviation, it sounds like you're whistling through your lungs. It's high pitch. And also demonstration of chest pain. It can be dormant and reappear when individuals' health becomes compromised. So again, carrier, again, just a right environment, and then it starts to manifest itself. TB in its early stages is treatable. However, if left untreated, it does destroy lung tissue. Okay, microorganism specific types of pathology and diseases. Are you guys familiar with these terms? You should be familiar with them by now. MRSA, VER. You've heard of MRSA?
Yeah.
Okay, so MRSA is methicillin-resistant Staphylococcus aureus. There's VRSA, there's VER. Methicillin in MRSA is one of the strongest antibiotics out in the market. So it's saying here that if you have MRSA, you are resistant to one of the strongest antibiotics. So which means that if you get that infection, strongest antibiotic is not going to help you. You hope your immunity kicks in and combats this type of pathogen. Same thing with vancomycin. Even stronger than methicillin is vancomycin. It's even stronger than that. And if you are resistant to vancomycin, oh, you better hope that your immunity kicks in. But MRSA is very prevalent out in the community. I'm not talking in the hospital, I'm talking out in the community. And I shared this with you guys in 153. One of the easiest way to catch MRSA is walking around in the gym barefooted. So make sure when you go to the gym, you go to the showers, you guys have some sandals that you can wear. Not as common, but it's also, you can also get MRSA by sharing your drinks. Athletic equipment like baseball gloves, hockey gloves, anything where it's moist and it's wet. I hope you guys aren't sharing cups. I don't mean drinking cups.
Oh, those we can.
Athletic supporters, yeah, don't share those because you can get MRSA that way too. Okay. But yeah, these are very strong. These are very strong antibiotics, and if you're resistant to it, it's problematic. Okay. CRE, carbapenem resistant. Carbapenem is a different type, a certain type of, again, type of medication. If they're resistant to that, again, problematic. C. diff, remember we said too much of a good thing? Overproduction of bacteria causing release of toxins which may cause sepsis or septic shock. And then other types of resistant medications. Okay. All right. Isolation precautions are mandated by various governmental agencies such as OSHA. And they help control the spread of pathogens that cause disease, prevent the perpetuation of the cycle of infection, and number 3, prevent the spread of disease from patient to staff and patient to patient. So OSHA is one of the governing bodies out there, agencies, that sets guidelines on how to protect you, how to protect the patients. And then we have the CDC who came along. You hear the CDC, they kind of come and go. They're like the Men in Black. They appear and then they're gone. The last time we saw them was, or heard of them, was when there was that measles outbreak in Disneyland. Was it, I think, about a couple of years ago? And then before that, they were gone for a while. But before that, the Ebola outbreak. Okay, so they figure out what the disease is, how it's being spread, and how to minimize the spread is when they come along. So they developed these guidelines, a two-tier system in how to protect you and the patients from infections. So tier 1 is standard precautions, and tier 2 is based on transmission-based precautions. Let me see, I don't remember my slides here. Okay, so tier 1, standard precautions and universal precautions. It basically describes what PPE stands for personal protective equipment, PPE, what type of PPE you wear for the different types of diseases, transmittable diseases out there. So again, minimum requirement is gloves. If it's airborne, if it's droplet, then it's mask. If it's a mist, then you're going to wear a shield. If it's something that you're going to come in full contact with on your uniform, on your body, then you're probably going to have to wear a gown. But that's what Tier 1 does, is it tells you what you need to do to protect yourselves from those different types of diseases. Okay, so Tier 1 refers to PPE, personal protective equipment. The second one here is transmission-based precautions, and that is how are we going to group these sick patients, how are we going to isolate them from the rest of the general population. And what I mean general population is protecting other patients, protecting nurses, protecting doctors, protecting visitors. Okay, so how are we going to separate them from the general population? So it's designed to place a barrier to the spread of highly infectious diseases between person with such diseases and the healthcare worker. It also means from isolating such infected individual from other patients, as well again as the general public. Isolation is generally category specific. These are some examples: airborne, droplet isolation. Then we have contact isolation, direct or indirect. So we talked about this earlier, that you see one of these signs before you enter the patient's room. It'll tell you exactly why the patient is being isolated, and then how you're going to protect yourself from that type of disease or pathogen. Okay. So the first one here is airborne isolation. Airborne isolation. So some examples of airborne diseases includes SARS, sudden acute respiratory syndrome, smallpox, chickenpox, rubeola, anthrax, and also tuberculosis. And I get this all the time. Chickenpox, I thought that was contact. What happens when your skin dries up? What happens to the skin? It goes up in the air, and now you're breathing it or you're tasting it, and that's how you get it. So chickenpox can fall under airborne as well as direct contact. So how are they isolated? Well, they are isolated in a private room with negative pressure. So negative pressure means that when you enter the room, you hear like the air getting sucked back into the room. As opposed to like when you walk into a department store, you feel the wind, the air conditioning blowing on your face. That's positive. So negative is the air that gets sucked back into the room. Okay? So private room with negative pressure, you may or may not, depending if it's TB, you're going to wear a TB mask. You want to keep the door shut and practice standard precautions. Now, anytime you enter the patient's room, whatever, if you're bringing in equipment in there, you wipe down your equipment, okay, if you're doing a portable exam. Then when you leave the patient's room, you're also going to wipe down your equipment, and then where are you going to dispose of your PPE? Where's the receptacles usually? Is it outside of the room or inside of the room? Inside the room. So you can dispose your PPE within the room. But before you leave, what are you going to do? Wash your hands, okay? Wash your hands, go outside, wipe down your equipment. Droplet isolation, droplet-borne contamination when the individual coughs, sneezes, or talks, and then we talked about the 3 feet zone. It includes influenza, mumps, whooping cough, pneumonia. The private room, you either have a private room or shared with individuals having the same infection. The room may be left open because it's droplet, it travels only 3 feet. Mask if within 3 feet. Again, practice standard precautions. Contact isolation. If it's direct, person to person, we have wounds, scabies, hepatitis A, herpes, lice, conjunctivitis. What's another name for conjunctivitis?
Pink eye.
Pink eye. Then we have MRSA and we have VER. If it's indirect, remember any object that's been contaminated is called a fomite. So direct or indirect, the patient is in a private, secluded room, or they are shared with other individuals having the same infection. Practice standard precautions, at least wear a glove before entering. You may have to wear a gown because if you are leaning on them, if you're pressed up against them, you want to protect your clothing. And careful handling of dressing and other contaminated material in this type of isolation. Okay? Next one here is expanded or strict isolation, broken down into 2 different categories. In expanded isolation or strict isolation, it just means that you are wearing everything, because you may be dealing with a patient who is highly infectious. You can get contaminated or transfer the infection through droplets, through airborne, through contact, through indirect contact. You're going to wear everything. That's strict isolation. Okay? And then here's the other extreme. You're going to wear everything, but you're not protecting yourself. Who are you protecting now? You're protecting the patient. So this is the other one, and this is called reverse isolation. Okay? Because now you are wearing everything, all the PPE, to protect the patient. And these are patients whose immunity has been greatly compromised. A burn victim, someone who's had open heart surgery, someone who may have had some kind of organ transplant. Okay? So they are highly susceptible to infection. So we're going to wear everything to protect them. Okay? So these type of patients, they have dedicated equipment and instruments that are to be kept in the room, which means that they're going to have their own stethoscope, their own blood pressure cuffs. If you will notice that nurses use cuffs on all the different patients in the rooms. They use the same stethoscope on all the different patients. Here, they have their own. Okay, they have their own equipment. Another thing that you want to keep in mind is those who are in reverse isolation, you're not bringing any type of vegetation in the room. Flowers, plants, the soil. The soil is what's going to have those little bugs in them. So we don't want to bring those little bugs into the room. Remember, microorganisms, bugs, they like to live in moist, dark, warm, highly nutritious environment. And you're going to be bringing it in if you're bringing this stuff in. Okay? And then obviously no sick visitors and staff to enter the room with someone who has reverse isolation. Okay? That was easy.